my name is Janelle. I'm one of the graduate advisors here at Keystone with the Keystone Adult Career Diploma High School program. And I am here interviewing someone very special for our Career Connections. This is Dr. Virginia Wangerin, who also happens to be my mother. And she's going to talk to us about the field of nursing and what it's like to be in the nursing career field. So, Jenny, as she goes by, Mom, tell us about yourself and what you do.
Well, that's a big question at this point in time, right? But I have been in nursing as a field. Actually, I could say since high school, because I started as a nursing assistant when I was in high school because I had an interest in nursing and I wanted to know more about it. And so through some connections, we facilitated developing a CNA course, which is Certified Nursing Assistant for high school students. And so I got started, a taste of it there, and then went on to get my nursing education. And, as Janelle knows, I have gone through every level of nursing, and I'll discuss those in a few minutes because that's one of the things I think is so great about nursing. Eventually, I ended up getting my PhD in higher education, and which really helped me in my career where I moved from being very active in the practice of nursing at the bedside, caring for patients, into education, and then into educational leadership, and now I work as a consultant. So I've had many careers as a nurse, and that's one of the things that I think is the beauty of nursing. So what I do now is I actually help leaders who are leading nursing programs or developing nursing programs or trying to make changes in their programs. I work with faculty who want to increase their skill in teaching and guiding students, working with them out in the clinical settings and so forth. So as a consultant for nursing education, I really touch every aspect of that career sect, if you will.
Mm-hmm. You very much come full circle from starting as a CNA to now teaching the people who teach people to be a nurse. That's pretty cool. What led you to this career?
It's interesting. Over the years, I've kind of thought about that. Many people who come into nursing choose it because it's a field they were touched by, right? So many people either had an experience of their own health being addressed and really impressed with what they received, or family members who, they got engaged in watching healthcare providers, nurses, and doctors as they had people in health. So I think that was probably true with me a little bit. I will say that, when I was in high school, I couldn't decide whether I wanted to be a teacher or a nurse, very traditional back then. And, but, I'd had a hospitalization when I was in 6th grade. I think that had an impact. I also really, just in regular checkups with the doctor and being there with family members, there was a nurse who became one of the first nurse practitioners in the state of Iowa. And her name was Dixie. I still remember that. But she just impressed me so much as a person and by what she did. And I think that really, I thought, I'm going to try that first. And so then that's what led me to the nursing assistant. And then yep, this is for me. And it has to be a fit like that. You have to experience a little bit and say, oh yeah, I want more of this, because it is challenging in many ways, but it's also more rewarding than a lot of other careers could be, I think.
I would agree. I definitely knew right away it wasn't for me. Sorry.
I remember that.
Yeah, not my cup of tea, but I think you do have to be passionate. So what would you say is something that would surprise others to know about this career?
I think maybe just the fact that it isn't what you see on TV. There's a little of that, but on TV, actually, a lot of what the doctors do is what nurses really do. So I think people would be maybe surprised if they hadn't experienced it to know that the nurse is truly the center of their care, the most important person in many ways, because they're the only thing that stands between that patient and everything else going on. So their role in keeping patients safe, but also in encouraging them towards better health, being there to answer questions. I mean, the nurse is, in my mind, in my humble opinion, right? the most important person there, and she really is the team leader, whether it's a small team or a major medical center. So I don't think
Yeah.
people realize how important and influential the nurse is to the care the patient gets.
I certainly know, and all my experiences, and especially with my kids, that is very, very true. And you definitely want to make sure you get to know your nurse well, because they're the ones that are going to help you.
Exactly.
All right. More nitty gritty. What are the requirements and skills needed for this career?
So to be a nurse, you really have to have some critical thinking skills, some problem solving skills. You have to have good human relationship skills. Now, those can be developed, but you have to want to do that because you're going to meet people where they are. And very often that's not a place that we want to be in, right? They're going to be stressed. They're going to not be at their best. They may be frail, they may be very ill, they may be dying. So you have to have that level of care and compassion. But you have to be able to also balance that with making the right decisions, with using the science along with the caring. So we always talk about nursing being an art and a science. So the art is that compassion, caring, communication, empathy. But we also have to have the science. You have to understand what's going on with that person and what can you as a nurse do to help that, and how do you evaluate other things on that chart or that the physician is asking or family are doing or what your patient tells you. How do you sort that out and either support or try to change what's going on? So you have to have a strong knowledge base. You have to be willing to keep learning. Nursing has changed so much over my career. You can't just say, okay, I got my degree, boom, I'm done. That's it. I don't have to learn another thing. You are a lifelong learner. So you have to really embrace that.
Yeah. So what kind of education is required to become a nurse?
That's one of the most confusing and also one of the greatest benefits of a person going into the nursing career, because there are so many ways to get started. A lot of people start by getting that experience as a nursing assistant, or sometimes they call them patient care technician, but doing something that's entry level, serves as a source of income while you're in school, or even a job while you're in high school. And so that helps people get a sense, this is something I really want to do. And so that's what we call that entry level career, right? Certified nursing assistant or an allied health worker. And then in community colleges or technical colleges, depending on where you live, you can actually go for about 1 year and get a license, a diploma, and be able to sit for the license to become a licensed practical nurse, or in some states, they're called licensed vocational nurses. So that is a nursing role who works under the supervision of a registered nurse or another licensed person, such as a physician or something. And so that's an entry-level nursing. That's the first time you can use the word nurse to describe yourself, right? And 1 year, so it's pretty easy to get into. And then very often, a lot of people start there with the intent of becoming a registered nurse. And many go straight through, but they're working as an LPN while they're doing that second year. So at the community college, you're there for another year or year and a half, and then you can get an associate's degree in nursing. And at that point, with that associate degree or a 2-year degree, you can sit for the exam to become a registered nurse. And so then that's when you're what we often think of as the nurse, right? The registered nurse can work in a variety of settings. Now, concurrently, some people decide to go straight to a university, a 4-year college or university, and they want nursing as their major. And you can do that also. You can go straight into a very traditional academic setting, choose nursing as a major, and graduate in 4 years. And again, now you have a baccalaureate degree in nursing, and you can sit for that licensure exam. Interestingly enough, it's the same exam, whether you got the associate degree or the baccalaureate degree. It's the first level of registered nursing. You take that exam, and then you go into practice. Now, that's where sometimes people are confused. What's it take to be a nurse? But at that point, there are still many options. Many nurses, after a while, decide they want to get a master's degree or what's called a nursing doctorate. And in this case, they are getting advanced education so they can take on advanced practice roles. And those advanced practice roles include being a nurse practitioner. So you can actually literally have your own practice. You can really be much more independent, and you're really treating and diagnosing people. So it's closer to the physician's role, often working in collaboration with a physician. Others will go into other specialty areas, nurse anesthesia, education, higher level administration, even informatics and those kinds of things. So if you have somebody who really has that scientific mind and they love the technology, nursing informaticists are in high demand. Some become, they work in research. Nurses who work in research for pharmaceutical companies make tremendous money. So there's a lot of fields that people don't even think about that you can work your way into as a nurse that are very fulfilling, very engaging, require a higher level of education, but also you get a higher level of reimbursement, pay and benefits, experience, and so forth. And then there's the PhD. So we have nurses who go on to get an academic PhD, which tends to be more for research, leadership, and those kinds of things. So in academic circles, we tend to get very often the PhD, or some will get what's called an EDD, which is an educational doctorate. So there's lots of ways that you can individualize what you want to do with your nursing and get the additional credentials if that's the path you want to take. A lot of people they practice nursing. They practice nursing in the area where they love, and they do that their entire career.
And you did that for a long time.
I did.
You earned your degrees over a long period of time as you grew through your career.
I did. And one of the beauties of that is that while I was working, I started off in, med surg, kind of basic hospital nursing. And then I spent a good part of my career in intensive care units, emergency room, all that. And I did the catheter lab, doing heart caths and things. I even spent some time in the OR, assisting surgeons. So I got to do a lot of really interesting things in my nursing career. And during that time, I just continued my education part-time. So over many years, I eventually got those other degrees. I didn't have to leave my job to do that. And in fact, in nursing, a lot of your employers will help to support their staff to get those additional degrees because it really helps them.
That's awesome. Well, real quick, describe what a typical day might look like for a nurse.
Well, so for a nurse who's working in a kind of a traditional, if you will, hospital setting, or maybe an outpatient clinic setting, those kinds of things, their days typically will start early or pretty late, right? Today, most institutions will do either 8, 10, or 12-hour shifts. So you see a lot of 12-hour shifts in the hospital settings. And so that might be 7 in the morning till 7 in the evening, and then somebody comes in 7 in the evening and works through the night. But when you're in those acute care settings or you're working with patients, you do a wide variety of things. And like I said, it's not exactly like you see on TV. And it's not just about doing procedures. I think very often people think, oh, I can't wait to be a nurse because I can give shots and I can give them IVs and I can, do all these kinds of things. But a lot of what we do is really, we're always assessing the patient to make sure they're either getting better, or if something's not working, we are the first one to intervene and get things changed. So you're doing a lot of communication with all the other members of the care team. You do direct cares with the patient, and some of those cares can be very complex, like in ICUs and things like that. And other times they have to do more with dynamics. If you're a mental health nurse, a lot of what you're doing is emotional support and teaching them coping skills, things like that. So it's really a wide variety, which is one of the things I think is best about nursing. But I would say, in most settings, one of the things you really do is you do a lot of communication, and you do a lot of planning and assessing and changing the plan, and that kind of decision making. You do a lot of decision making, and you have to be able to think on your feet and do those decisions quickly.
Yeah.
Things like you walk in a room and your patient just doesn't look quite right. In 5 minutes, you've got an assessment done, you've figured out what might be going wrong, and you're out there calling the doctor to get this patient the care that they need. So, yeah, so it's busy. Nurses are very,
Busy.
very busy on your feet.
Yeah, for up to 12 hours a day. Oh my goodness.
Mhm.
Well, thank you. That was awesome.
My pleasure.
I'm so glad I was able to do this with you. I think nursing is such a obviously an invaluable field and been very special to our family. And I know that there's a lot of interest there with students. So I think it's really good for our students to learn that it can be, there's a place where you can start right out of high school and work your way into whatever area you want to be. And it's a very broad and lots of different paths you can take in nursing.
Absolutely. Thank
Thank
you.
you very much.